Well, joining me now is another very familiar face through this pandemic, public health expert Michael Baker. Thanks for joining us tonight, Michael. Dr. Bloomfield is going to leave a very big gap, isn't he? How disruptive could this be to the health sector?
Yeah, well, kia ora, Ingrid. Yes, we will miss him. He's provided excellent leadership during the pandemic. And I think the degree of disruption will depend very much on how long it takes to recruit a suitable replacement for him, but also for the other key job, which of course is the Director of Public Health position, which becomes vacant next week. And New Zealand is actually really underinvested in training public health experts for several decades. So this is obviously not going to fix the problem quickly, but it's something we do need to attend to.
So what's your big worry here then? What could we see?
Well, I think there could be some disruption, filling in these positions potentially with temporary appointments. The other thing to remember, of course, is that we're having the biggest health sector reform in a decade, or actually a generation, starting later this year. So that's another major function for the Director General of Health to work on.
So what are the key skills we're looking here from a Director General of Health?
Well, remember, historically, since the Ministry of Health was created, this has been generally filled by a career public servant, and their main role has been to manage a ministry and provide policy advice for the minister. And it may surprise people to notice that this position has not usually been a medical person or even a public health expert. So actually was a bit of an exception, but a very fortunate one when the pandemic hit.
Yeah, so it's more sort of like a bean counter, sort of nuts and bolts, logistics, that type of thing.
Well, I think the chief executives of these government agencies have a huge amount of things that they have to do very effectively. And it is obviously also serving political agendas as well, which I think can complicate the job.
And of course, before the pandemic, no one really knew who the Director General of Health was. Do you think we'll be going back to that?
I think we probably will, because the most likely next appointment will probably be more of a generic manager who can manage the change in the creation of these new public health agencies.
So maybe
I think the role of the Director of Public Health will become more important, and traditionally that's often been the person who's led the response to previous pandemics. And of course, these new agencies we're creating will also be very prominent, like the new Public Health Agency in the Ministry of Health, the Murray Health Authority, and Health New Zealand.
So maybe less TikTok dancing and more hands-on. Just very quickly, Michael, big shoes to fill. Would you give it a go yourself?
Look, it's a wonderful opportunity, but I think I'll stick to my day job as an academic. I mean, I still want to find a cure to rheumatic fever, so that's really my big ambition at the moment.
Very worthy aim there. Michael, thanks so much for joining us tonight.